Hi, I'm Saul Simon, and this is Simon Says Manage Your Money. Welcome, as always. I invite you to take a piece of paper and a pen to take some notes and ask some questions. Today's program is on the graying of America. And with me today is my guest, Dr. Beverly Friedlander, a doctor of cosmetic surgery in the area of plastic surgeon, right?
That's correct.
And you know, as Beverly and I had spoken and met and started speaking, I thought what an opportunity it would be to actually share some of her thoughts and insight, and maybe from her perspective, as to what she sees and what she's hearing as she's meeting people. We're all getting older. We're experiencing the normal ups and downs of life. And then we also started talking about the economy and the impact that that would have maybe on her business. So I said, why don't you come on the program to see what we can share with you, our viewers. So as always, I always welcome your feedback and your input. I love hearing your thoughts, which gives me the opportunity to then think as to who else would be a great guest to bring onto the program. So Beverly, thank you for coming on the program.
Well, thank you for inviting me. It's my pleasure to be here.
Yeah. So you've been a doctor in this field of cosmetic surgery for a number of years. I'm sure you've seen a lot of changes.
I have, yes.
Given what's happened in the economy, given what's happened in the world, has that affected you and your business?
Absolutely. I think it's affected everyone's business, and I think it's important in this business environment to maintain a certain degree of flexibility and to go with the flow, to follow the market trends and to be able to adjust your business practices to those trends. And in fact, that is what I've been doing.
Tell me how.
I am fortunate in being a member of the American Society of Aesthetic Plastic Surgeons, and my society maintains statistics on the changes that are occurring within the cosmetic industry in America. And what we have seen over the years is that over 50% of Americans approve of plastic surgery. Over 33% of Americans would consider having plastic surgery on themselves or have already had plastic surgery on themselves. Plastic surgery certainly is in the mainstream, and as a result of that, we are able to identify trends and to follow them. So that what I have seen over the last few years with the downturn in economy is that individuals are interested in maintaining their appearance because it improves their sense of well-being and their sense of confidence. But because expenditures are certainly an important consideration, what they're looking to do are procedures that are less invasive, ostensibly less costly, and yet are predictable in terms of their outcome. So that what we're seeing is an increased number of individuals who are interested in undergoing non-surgical means of cosmetic enhancement.
For example?
Things such as Botox or Dysport, which is a neuromodulator. And the use of the neuromodulators can significantly improve the appearance of the upper face. For example, it can soften the eyes, it can raise the eyebrows, make the eyes look less tired or fatigued or even less angry. And we're also seeing an increase in the use of fillers. And fillers are products which can be applied below the skin, which will plump it out and fill it out in such a way as to create much more youthful contours. And we're actually also seeing an increase in the number of procedures involving advanced technical applications, such as lasers. We're currently doing procedures for laser resurfacing and laser hair removal. And all of these have really been incorporated into my practice because this is what the public is demanding.
Does insurance cover any of these procedures?
I wish insurance did cover the procedures. For all intents and purposes, when a procedure is done for cosmetic purposes, it is not covered by the insurance carrier. The exceptions are very, very few and far between.
We're living longer. It's very possible today that if an individual is living at the age of, say, 60 or 65, it's very common or statistic that this person could live to age 90, 95 years old.
Absolutely.
And diet, exercise, and then overall well-being is very important. What impact have you seen with regards to the baby boomer coming in to see you to take care of their own well-being?
Well, one of the things that I've incorporated into my practice is the concept of age management. I discuss the importance of a four-letter word, diet, with all of my patients. I discuss the concept of exercising and also certain other concepts such as sun protection. And most importantly, although I think I'm seeing a little bit less of it today, we talk about the importance of cessation of smoking, because cigarette smoke can cause damage not only to the lungs, but also to the circulatory system. It causes premature aging of the skin, and it causes problems with healing. That being said, I do incorporate age management into my practice, and what I'm finding is that a lot of people actually are coming into my practice asking for gentle improvements, subtle improvements in their appearance. Patients today are very interested in maintaining a natural appearance. They don't want to look operated. They don't want to look tight or plastic. So that what we're seeing is someone coming in and asking for just a little tuck around the eyes, or something to make their appearance look less tired, or even asking about improvement in their frown lines. And that very frequently is the first step into the world of cosmetic surgery. It's a non-surgical enhancement, but as I said, it works beautifully. And because of the improvement that my patients are seeing, I think many of them, having taken that first step, are interested in undergoing further surgical enhancements.
Tell me what a consultation looks like.
What a consultation looks like.
So I come in and I say hi. And that's not the way we met, by the way, everybody. So I come in as a consultation. What do you try to accomplish? What is it you want to find out from me? What are my goals? Tell me what happens. What does this consultation look like? Well,
we start by finding out exactly the areas that you're interested in improving upon. So I'll ask you, Saul, can you tell me a little bit about yourself? What are the areas that bother you? What are the areas that you would like me to address? And then, of course, you would answer.
Yeah.
And we would speak a little bit about that, and then I would look at your medical history. I think it's very important to assess the individual as a whole and not assess them based upon the areas that they're looking to improve upon. So we'll go through your medical history, if you're taking any medications or if you've had any significant illnesses in the past, and we'll discuss how that might impact upon your recovery or upon the procedure that you're contemplating having performed. And then after we've completed that, I'll do a physical examination. And again, depending upon the nature of the procedure, we may just limit the examination to the region that we're addressing, for example, the face or the body, or we may perform a complete physical examination depending upon what, again, your needs are. And then we would talk about the specifics of what you are interested in pursuing. For example, in the male population, the statistics have shown that the 5 most common procedures are actually liposuction of the love handle, blepharoplasty or eyelid lift. Some men are looking for breast reduction because they have fullness located within their chest tissue, which they would like to improve upon to maintain more youthful contours. And in men, actually, rhinoplasty is one of the most common procedures that are being performed today.
What is rhinoplasty?
Rhinoplasty is actually nasal reshaping, and many men are looking for an improvement in the shape of their nose, and sometimes also that comes with an improvement in difficulties that they may have breathing.
Interesting, interesting. How did you get into this business?
Well, that's an interesting question that I could spend hours upon hours talking about. I've always been intrigued by beauty, by both the art and the science of beauty. And I've always been excited by the changing within the seasons and the changes that occur within, for example, flowers or trees or the entire environment for that matter.
Pretty.
And in medical school, we were exposed to that very early on with the changes that occur within the life cycles. Birth to adolescence to young adulthood, middle age, and then finally older age. So I was drawn to the science of restoration and of course plastic surgery lends itself to that. So we began by trying to restore defects that had been created as a result of trauma or as a result of surgery. And the techniques that I learned doing that, I have been able to apply to restoring youthful contours and natural contours to the human body. And these are contours that are more in keeping with a lifestyle than in keeping with a given age, particularly considering the concept of the graying of America.
Right. That's great. That's great. You know, given when I speak with doctors, I have a number of doctors that are clients. And we very often talk about insurance because it pays the bills and it helps the people to have the services that they provide taken care of. You're not in an insurance business, and I would think you're in a cash business, relatively. Is managing a business difficult as a doctor today?
I think managing a business is difficult within any profession, unless, of course, you have an MBA or finance as your area of interest.
But even if then you have that, it's still challenging.
That is very, very true. Yeah. In medical school, we were never taught about the concepts of business management. Most of us went into medicine for altruistic reasons. And we found that when we entered into medical practice that we were unprepared for the responsibilities of paying the rent, dealing with salaries, dealing with human resources, paying our loans, etc. And it was an education in and of itself. And I think most physicians learn early on how to be efficient and how to manage a business. The managing of a business is very much a part of medicine today.
Clearly. People don't realize that you weren't taught this information, you weren't taught this material in the area of management. And very often we're taking more time managing our business than we are doing what our passion has. Hi, welcome back, and thanks for joining us. I'm Saul Simon, and this is Simon Says Manage Your Money. Today's guest is Dr. Beverly Friedlander from Short Hills, New Jersey. And I just, again, want to thank you for sharing your thoughts with us. You know, something personal recently that happened to me is a girlfriend of mine in town. She and her sister was diagnosed with a gene to acknowledge that she has breast cancer. But she didn't have breast cancer, but she had a gene that determined that she could have breast cancer.
Yes. Okay.
So as you can see, I'm not really clear how I'm speaking it, but I'm glad that as a doctor you understand what I'm saying. So she and her sister actually were proactive to have a double mastectomy. And I'm friendly enough with her, through her husband and I, to actually inquire and ask the question how courageous and how bold she was, and her sister, to go ahead and seek the assistance of a professional like yourself to alleviate the problem, hopefully, and then do reconstructive surgery and take care of her well-being. Do you see? So I was caught off guard. I was caught off guard because I said to myself, if I did have that occur for me, would I have done something of that nature? And I think the answer would be yes. And do you see it a lot?
We do. My practice is actually a combination of cosmetic surgery and reconstructive surgery.